Scoping the shoulder. It is done for rotator cuff tear, labral tears, subacromial decompression, AC joint pathology, bicep tenotomy and tenodesis, beach chair position. Posterior portal is 2 cm inferior and 1 cm medial to posterior lateral coron of acromion between infraspinatus and teres minor. Similar like Jude approach of posterior approach to the shoulder. Lateral approach is 1 to 2 cm distal to the lateral edge of acromion, pass through the deltoid. Anterior approach is from inside out technique. It is lateral to coracoid and anterior to the AC joint. It is above lateral half of subscapularis and medial to the bicep pulley. Risk of cephalic nerve injury. Anterior inferior portal is for placing anchors for anterior labral repair, and posterior inferior are for anchors for posterior labral repair.